This video is disseminated on behalf of Rocket Doctor AI. Hey guys, welcome back to the channel McNallie Money, your home of all things stock, investment, and personal finance related. In today's video, we're going to be joined by the team from Rocket Doctor AI talking about strategy, outlook, and growth for the organization. Very excited to get into today's interview. Before we do, take a second, hit the like button, guys. Big help to myself and the channel, specifically in getting this content to other people like you who may find value. If you're not already subscribed, McNallie Money, feel free to join and let us know in the comment section below if you've heard of Rocket Doctor before or you're currently holding shares. With that being said, let's get into today's interview. Okay guys, that's right. Today's video, we're going to be taking a look at Rocket Doctor AI. This is a very exciting company. We're going to talk about some of the details, outlook, and growth in today's video. We're joined by Dr. Bill Cherniak. He's the founder and CEO of Rocket Doctor Inc., along with Dr. Essam Hamze, the CEO of Rocket Doctor AI. So welcome to the program, you guys. Thanks so much for taking the time.
Thanks for having us.
Thanks.
Of course. Yeah, I'm looking forward to this one. Before we get into it, I guess maybe to start off, can you give us a lay of the land, kind of company org structure and how these two divisions or companies come together?
Sure. Yeah, absolutely. As you mentioned, I'm the CEO of the parent company, Rocket Doctor AI. If you look back at our news releases, it used to be called treatment.com AI. And we'll be talking some about the technology there with the GLM, the Global Library of Medicine, and some of the solutions there. We got introduced, we were told there's a great company you should meet from one of our partners, Google, who we both work with. And so we met, and it was just a perfect combination of companies together. And so we finalized and concluded that acquisition back in April. And since then, Rocket Doctor Inc. has been operating as a subsidiary within our company, and we rebranded as Rocket Doctor AI as a parent company just to show our kind of mission to provide AI-powered solutions in healthcare for the full continuum of care and the whole healthcare space. And so, as I mentioned, I'm the CEO of the parent company, and Bill, you can introduce yourself as well if you like.
Yeah, sure. Glad to. Thanks, Essam. That's a good highline. And yeah, my background's as an emergency physician, trained in family practice, global public health, and started Rocket Doctor Inc. In 2020, and then joined the team under now RDAI in the spring. So I'm excited to chat with you more.
Yeah, I'm looking forward to it. I just picked up, you said Google is one of your partners, so I'm sure we'll touch on that one again. Obviously, a great partner to have in the space. Now, can you give us a quick overview of what Rocket Doctor AI does, or kind of the elevator pitch for the company?
Sure. Yeah, as I kind of alluded to in the beginning, and why we kind of combined forces here, is that we have proprietary software that provides AI-powered solutions that help the practitioners see patients wherever they are and whenever they want. And so we talk about the Global Library of Medicine, which we will in a second, think of it as the doctor's brain. We've created a proprietary software that took, I think, over 8 years to develop, and I think 25,000 hours of doctors and practitioners around the world contributing to it, that has the ability to diagnose and triage patients before the visit and bring in that information to the practitioner, help the doctor or the nurse or the pharmacist or whoever it is during a visit, and then even check up with the practitioner after the visit. Check up with the patient after the visit and see how they're doing on their antibiotics and so on. And with Rocket Doctor, when we acquired them, they were seeing patients directly. So what I'll do is I'll let Bill kind of explain how Rocket Doctor interfaces with the practitioners and the patients, and then we can kind of bring it together again.
Yeah, from our perspective, I describe us, and Essam's heard this a number of times, as the Shopify for physicians. So helping doctors to build and scale our own independent practices, largely virtually, but in some hybridized in-person and virtual models of care, And that's done on the proprietary electronic medical record system that we've built with various AI-enabled tools. And then we take all those docs, we put them out to patients, largely in rural and remote communities across Canada, and then largely on Medicaid and Medicare, so government-funded health insurance in the United States and in rural communities. So natural synergy to partner with RDAI, formerly treatment, to plug some of those AI tools like the AI nurse into the EMR platform and the full gamut of the patient experience to help patients and providers.
Yeah, it makes sense. You can definitely see the synergies. Now, in terms of the problem or the root problem you guys are trying to solve, obviously there's a lot of money, there's a lot of time, there's a lot of data in this space. What would you say is kind of the main goal behind the organization?
Yeah, I mean, the great thing about it is that we're in a market that is probably the biggest market, and it's also the most backwards market. And in terms of kind of technology adoption and so on. So not only is it, sucking up a lot of money around the world, it's incredibly inefficient as well. So there's a big problem there, and there's solutions. We're providing solutions to kind of help that. So if you ask us, what are we trying to fix? We're trying to fix the inefficiencies in healthcare and improve access to care. And that is a worldwide problem. It is definitely a North American problem. And the great thing about it is when you have a problem like healthcare, and we start talking about saving money and improving care and improving accessibility, you get the buy-in from everybody. You get the buy-in from the payers. I call it the three Ps: the payers, the practitioners, and the patients. They all love the idea for different reasons, right? The payer is saving money. The practitioner loves the efficiency and the ability to see more patients and do less administrative work. And then the patient loves the accessibility and being able to talk to someone and see something, a little bit faster than historically they were before, and getting better diagnosis and better care in the process as well. So that is what I think is the biggest thing that we're trying to solve. I think it's inefficiency. I don't know if Bill, you would say something differently, but that's kind of for me what I see.
Yeah, I agree. I think I'm a numbers kind of guy, and so by the numbers, there's 6 million Canadians who don't have a family doctor. There's about 150 million Americans on Medicaid and Medicare. In parallel, over half of the doctors in North America identify that we're burnt out and are spending up to a day a week on non-clinical administrative duties. So if you kind of put those pieces together, that's how the marketplace, AI tools, increasing access to care, that's how the whole thing kind of fits together to solve those major problems that we're trying to tackle. And as Essam said, it's a rather large problem that we're aiming to solve or help to, anyways.
Yeah, I was going to say, you talk about TAM or total addressable market, and it doesn't really get much bigger than healthcare. My wife and I have two little kids, and obviously, once you throw those into the equation, healthcare becomes even more important to a family. Now, I think you mentioned earlier the GLM, the Global Library of Medicine. Can you tell us a little bit about this platform?
Yeah, I alluded to it a little bit earlier on, but the Global Library of Medicine was created with a couple of hundred doctors in our network around the world, over, I think, 25,000 hours over 7 or 8 years, to kind of bring together proprietary information into this library, number one, and then proprietary algorithm applied to it, so that it has the ability to think like a doctor's brain. And why I say that is it's really important. It's not like a decision tree where, if someone says they're having chest pain, they're going to be asked the same 10 questions no matter what. It actually thinks like a doctor before it even comes into the room. So it takes into account, are you a male or a female? What age are you? Do you smoke or not? Past medical history and so on, before it even asks any questions. Because a 20-year-old with chest pain is completely different than a 70-year-old smoker with chest pain, right? Completely different. Someone with fever in Africa is completely different than somebody with a fever in North America, malaria and not. And so it's important to take all that into account. And then when it's talking to the patient, it has the ability to adjust dynamically in real time. So it'll ask a question of what's wrong. If you say, I'm having chest pain, it'll ask the next most important question, next most pertinent question. In real time, it'll dynamically shift. You can actually see it thinking, and it'll ask the next question. Depending on how you answer that, it'll dynamically shift in real time and ask the next most important question. And so by doing that, not only are you getting a good history, but you'll see with our technology, and I'm sure you've seen demos, you'll see it thinking in the top right-hand corner a lot of times about what the differential diagnosis is, what you could have with percentages of what you could have based on our algorithm. And then also it'll indicate what blood work you should do, what imaging to do, and so on. So if you think about the practicality of that, imagine a Sunday night, as I always say, where your options are, if your kid is sick, is go to emergency or go to ChatGPT and freak out, right? I mean, there's not a lot of options, and neither one is good. And so imagine an AI nurse calling you or going to a portal and talking to an AI nurse that has the ability to ask the questions to see if you really should be going to emergency or whether you can wait for the appointment, but also all that history given to the practitioner ahead of the appointment, maybe indicating whether you should go for some blood work or a throat swab or something ahead of the appointment, analyzing the results when it comes in as well. And then when the doctor is seeing you, either virtually or in person, they already have a lot of the administrative stuff done already. They know you should be there because you've been invited to come in to be seen. And so it's a lot of efficiency there for sure for the practitioner. And then maybe assigning the nurse to call you the next day to see how the kid is doing on the antibiotics as well. Because historically, out of sight, out of mind when you talk about clinics and hospitals, right? Until the next major emergency comes back. So that's kind of the idea of the GLM and how we've created it to mimic the idea of a doctor's brain, but also with information that will not hallucinate, will not be contaminated by any outside sources, is not a large language model LLM like a ChatGPT or Google, and can talk to the patient in whatever language they would like to talk it to.
Yeah, I was actually going to ask about the language barrier there as well. And again, as a parent, I've done both of those options, sitting in an emergency room all night and going to ChatGPT. And like you say, neither one is very settling as a parent. So you just made a perfect segue there to the next portion here. Tell us a little bit about the AI technology as well. You mentioned it's not an LLM. How does this technology go in, analyze this amount of data, and then make these unique or situational, I guess, prescriptions?
Yeah, again, it's kind of proprietary information that we brought in through all sources like the medical studies and guidelines and so on over the years to create this library that's been tested tens of thousands of times. And we have doctors within our panel that actually analyze it before it gets into the global library of medicine. So we curate it and then we kind of protect it. And so there's no outside forces that can go in there and change it. So it's in there. And then we use, like I said, our AI algorithm to be able to draw from that. So it takes into account all the different risk factors. I think we have over 17,000 risk factors and data points and so on that it can take into account when it's analyzing what to ask you next and so on, in which order to ask you. So that's kind of how it's been developed. What's interesting though is that with Bill and Rocket Doctor Inc. and their platform, they have also AI powered tools as well that we're integrating with. And so maybe Bill, it'd be great to hear a little bit about your platform or our platform basically, and the AI tools that you've also developed.
Yeah, for sure. So, like we heard earlier, we met through Google. And so that was in part because we were one of 10 companies in their inaugural AI First Accelerator program in spring of 2024. And as a part of that, I demoed a prototype at their office in Mountain View called Rocket Doctor Connect, which takes similarly a series, and this is why we get along, is because we've taken this approach of clinically developed AI and more Bayesian logic stuff as opposed to just unleashing a chat GPT on the world or LLM to diagnose healthcare conditions. So we have these clinically designed algorithms about reasons patients come to see a doctor. We call them chief complaints, put into a system to basically find out, is a patient appropriate for a virtual care visit, or do they need to sit in that waiting room and go to the emergency department? And so that system is just getting put out now and being tested in a formal research trial, actually, which is really exciting, moving that stuff into production.
Yeah, it certainly is. And we interview a lot of companies on the channel. It seems AI is kind of a tagline now. Everybody wants to be associated with AI. It seems you guys through your Google partnership. This is really embedded in the DNA of the company, so to speak. You mentioned you've had tens of thousands of interactions with patients. Can you tell us some of the success stories, the most common kind of patients you see, or any of the results you've seen so far?
Yeah,
Sure. Yeah, Billy, you can go first. Yeah.
to start. And I'll just say, before Rocket Doctor started, part of the impetus actually was if you've ever heard of a guy called Eric Topol from Scripps in San Diego, he wrote a book called Deep Medicine that I read back in 2019 before quote unquote AI was cool, but started to think about, could we use all this data to try to develop these predictive analytic tools and use it in important ways like this. And so we've actually helped over 700,000 patient visits happen through the platform since we launched in spring of 2020. And, we've done different data analytics about what are the key reasons that people come to the plat. And that's how we picked the top 20 chief complaints for the Rocket Doctor Connect system as we analyze the data to see, what are reasons people come through. And they're typical things like cough, cold, flu symptoms, but also because we're not just a walk-in clinic, it's you can get a family doctor, a primary care physician. It's things like hypertension or abdominal pain or chest pain or need a prescription refill or pediatrics, like you said before, women's health, men's health. It's all sorts of things under the sun because it's healthcare, it's comprehensive medicine, basically.
Yeah, and I think one of the interesting things is if you look back at some of the news releases, one of the things that we've been using it for is medical education. So the Global Library of Medicine was born, out of the University of Minnesota area initially through the founder, Dr. Kevin Peterson, and so on. But in medicine, there's something called the OSCE exam. It's a clinical exam. You probably saw the Seinfeld episode as well, where they have patients, the fake patients, and then you have to go and interview the patient and try to figure out what they have. And the student comes out and writes their differential diagnosis and moves on to the next room. And so we've been able to develop it into both an AI patient and an AI doctor solution for the students and the residents. And so University of Minnesota recently, just this I think this past semester, they actually used it in one of these OSCE exams to replace a lot of the patients and saved, I think, over 40% of their costs, the administrative costs. And we were able to give immediate results back to the student on did they ask the right question, did they ask the right order, did they come out with the right differential diagnosis immediately, where historically it took up to 3 months to mark these exams and used to cost hundreds of thousands of dollars to run these exams. And so we are able to test and train the medical students, in real time, which is great. And it's trusted, and to the point where I believe the University of Minnesota is actually going to be coming out with a research paper on how that went. So that's really exciting. One of the things I always talk about, and it's in one of our decks as well, is that we actually snuck it into one of these medical exams at one point. And we gave it to a non-medical student, someone with zero medical training, didn't understand the words she was saying. Nobody knew she was there except for the dean of medicine, I believe. And we told her to go write the exam. And she was able to get 11 out of the 12 rooms right on the first diagnosis and the 12th patient on the second diagnosis with zero medical training using our platform, the Global Library of Medicine.
Wow, that's pretty remarkable. Now, I would also imagine you mentioned the word trust. The more involved you guys are in the teaching, the education portion of this, once those physicians graduate, I would imagine they're already comfortable with the platform. It makes it a lot easier transition. You also mentioned this 3P strategy and specifically the payers. Can you talk to us a little bit about the multi-payer strategy? And efficiency is obviously great. It reduces costs, but what is the response from the payer side?
Yeah, I'm happy to field this one. And so, when we talk about payers, specifically, we've done a bunch of news releases recently on our partnerships across the United States. And so, to that extent, we noticed that from the beginning, there was a big gap in the market for access to care for patients on Medicaid. And, that's the health insurance for folks at or below the poverty line, pregnant women, all children across the United States, about 80 million Americans. And then additionally on Medicare, which are folks 60 and above who are seniors. And so the idea there is that we've built a system that's specifically designed to take care of those patient populations. And we've built these different AI tools and technical infrastructure to be, the best at it. And so we've won contracts recently that we've announced with a variety of different brand name insurance companies across the United States. Aetna, we announced in the summer, and then a multitude of other payers like United Health, Anthem, Humana, and a bunch more that are coming through the pipes in the not so distant future. And so those are with Medicare Advantage, Medicaid plans with Central California Alliance for Health, also, which is a regional plan with 500,000 members, as well as actually some commercial plans because, recognizing that we can take care of, all patients. And that's kind of our multi-payer strategy that we're really good. We have a specific expertise on those government-funded health insurance patients, which, we're on both sides of the border in Canada and the US. And I always joke the closest thing to the Canadian single payer system is actually government funded health insurance in the US is Medicaid. Federal mandates evolve to the states. So we have a skill set in that approach. And we can also take some commercial folks as well into the mix because we have some of the best board certified physicians that are on the platform.
Yeah, that's great. Now, Bill, you mentioned you're on both sides of the border here in North America. In terms of global expansion, you mentioned the multiple language options there. What's the plan for global expansion, or what markets do you serve right now?
Yeah, I mean, currently we're in Ontario, Alberta, BC, California, New York, and Maryland. And I'll just say that the TAM for healthcare in the United States is about $4.5 trillion. And that is equivalent to the entire world combined for its healthcare spend. So we got big markets even just where we are in these three states and provinces, and probably North America is the focus. But if Esam's got other ideas.
Yeah, I think yeah, I think the answer to that is that we are a software solution, period. We are not a service company in any way. And so what that means is that we can sell our solution as well, right? So we can white label our technology and sell it to other companies and other governments and other healthcare organizations and so on. And so, that is something that you can look forward to, and it doesn't stop at a border. The great thing about our technology is that it can sit on a healthcare organization's own server behind their firewall and not worry about healthcare data, which is probably the most valuable data to be hacked, leaving a server or going back and forth between different countries or provinces or states or whatever, which is what you don't want to happen. So we have the ability to white label and sell our solution to others around the world. And so it's something that we definitely are looking for. We did announce a collaboration with the University of Edinburgh last year that we're continuing to kind of pursue and grow on as well.
Yeah, we cover a fair amount of AI HPC companies on the channel, and data sovereignty, which you just mentioned there, is crucially important, especially with healthcare. Like you say, that's kind of the
Yeah.
most personal information you have. So that's great to think you guys are aware of that. And Bill, I guess to your point, you've got your hands pretty full with Canada and the United States with that size of market. Now, in terms of the platform itself, obviously you've made a lot of improvements and progress. What are kind of the next features or add-ons, innovations that you're focused on?
Yeah, I think for the GLM side of it, again, like as mentioned, is that it can be applied in many different ways, and it can be presented many different ways. It could be text-based, where you're chatting with an AI agent or a agentic type of agent, like an AI nurse or whatever. It could be voice-based, where it calls you or talks to you in whatever language you speak. For the elderly, one of the things we're looking at is actually having kind of the 3D, AI virtual reality type of patient, doctor talking to the patient as well, because sometimes they want to see it visually as well. But I think at the end of the day, our focus is to make sure that we're not just creating a gimmick or creating something that looks good. It actually has real world value, and something that I'm sure you're looking into in your investments is that it's commercially viable. I mean, with my last company, we did about 20 different transactions, but I probably looked at thousands of companies, and there's a lot of great ideas. But as a doctor and as in business and tech, I kind of understand all levels of, yeah, that looks fancy and looks great. It kind of makes sense, but I know doctors and they're not going to buy it. So is it commercially viable or not? And so we're really focusing on for our shareholders, the idea of can you sell this and make money, which is again a big question of a lot of AI companies out there. Number one, do they actually have true AI solutions, and is it proprietary, or is it just a LLM wrapper? But number two, are they ever going to make money on whatever they're trying to sell, right?
Yeah, that makes sense. Go ahead, Bill.
Yeah, from my perspective, I think about it in kind of three buckets. One is the AI features to help reduce manual functions and just improve overall efficiency in the system. So, of course, working and getting the RDAI technology integrated along with the stuff we talked about that we've been building from Rocket Doctor Connect. Then there's the pipes and plumbing. So, getting interconnected with all of the different data systems in all of the different national, state, provincial territories, and there are lots of them, but making sure that we can pull and push all that data for interconnectedness. And then the third are just the day-to-day, clinical features. And we announced we want a grant from the Canadian federal government actually to help build out some of the secure messaging components on the platform and things that will just make patients and doctors' lives easier. So those are kind of the three big buckets.
Yeah, I saw that press release. I'm based in Alberta as well, so I know you guys serve that market. It's music to my ears, to be honest. Now, in terms of investors, obviously a lot of them, retail investors watching this, what can they expect in terms of upcoming catalysts? Bill, you mentioned you've signed a number of big partnerships. You're in some universities now. It seems like you guys have kind of hit that critical mass or snowball effect point. What should investors be looking for next?
I can start, I guess. Yeah, I think you hit the nail on the head. I mean, if you kind of follow the story, I love telling stories, right? So I love kind of building it up so that because people come into the story at different points, and you can't expect them if they're coming at the end to understand how you got there. But it is important. It is important to understand that the reason we did the stuff we did and the way we announced things is that we're at that inflection point now. We're at the inflection point where we are, yes, an AI company. We've announced our first quarter in Q2 with some revenue with our acquisition of Rocket Doctor. We're about to announce Q3. But with all the announcements of coverage in the US, the reason it was really important to kind of talk about that is that as we start talking about expanding in the US, when a patient clicks on an ad in the US, they can actually, hopefully, or a lot of them can be seen now because of the fact that they're covered by these plans that Bill has announced and so on. And so that's kind of really important. So I think in terms of what to look forward to is that inflection point that, hopefully we're going to be able to continue to grow that revenue organically versus, acquiring a number of companies and buying the revenue. We're trying to, grow this organically. So that's the top line. And then we're trying to improve the bottom line as well, using the technology we're talking about, integrating it to create efficiency and improve our numbers as well on the bottom side. So I think what's exciting is more contracts. Hopefully we can announce more partnerships, more joint ventures, and at the end of the day, growing a company that increases its value to the shareholders with increasing revenues and so on.
Great. Yeah, this has been very informative. I've got a lot of context here I didn't have before. Now, we've linked your guys' website, all the social media below. I'll give you a chance to close out, but if you guys do have any additional questions for the team here at Rocket Doctor, feel free to leave them in the comment section below. I'll let you guys close out, or maybe some final thoughts. Bill, if you want to go first.
Sure. Well, I'll just start by letting your audience know I'm not sure if they're focused in Alberta more or less, but went to med school in Calgary, and we've grown quite a lot in the province. Actually, we announced some stuff in Q1 about expanded growth, but are seeing something around 300 to 400 patients a day, and announced a partnership with the town of Bruderheim and have a bunch of exciting stuff coming out. And that's one example of many kind of things that we're doing across Canada as well for folks on both sides of the border. So I just think it's exciting times, and we're seeing the scale really kick in as we continue to push things ahead. And we'll flip to Essam for his thoughts.
Yeah, and nothing against Calgary, but I grew up in Edmonton and went to U of A. Having said that, we are growing obviously in Alberta and across the country, but also in the U.S. It's a huge area of growth for us. It's really important for us to do it properly, and this is something that we're really focused on. I think for your investors, what's exciting is there's not a lot of. I've been investing since I was 18 years old, and so there's one thing to invest in gold companies when they bring out these cores, and you can look at the gold and all that. It's different when you're actually investing in a company that touches you day to day in terms of healthcare and technology and so on, and you can actually see it and maybe use it and try it and so on. That's exciting for me as an investor. I go to the Peter Lynch type of investment school of you can invest in stuff that you understand and can see in the mall or wherever it is. And so I think that's exciting that you can relate to it. And we try to relate to the investor, both as an investor, as a potential patient and customer and so on.
Yeah, that's phenomenal. I'm actually from Calgary, so I won't hold the Edmonton rivalry against you there, but phenomenal work you guys are doing and very exciting. Like you say, it hits close to home. Every single person in the world needs medical care multiple times a year. So this is great to hear. If you guys are still watching, hit the like button. Feel free to subscribe to the channel. As I said, if you have any additional questions for the team, feel free to drop them below. We'll make sure they get over to the gentleman on the screen here. But you guys, thank you so much for the time. Very innovative work you're doing, and we wish you all the best.
Yeah, thank you for having us again.
Thanks. Appreciate it.